Hello, I'm Mary, and Wayne hired me because he has teeth missing, and the last kid that saw him on camera didn't sleep for a week. Oh my gosh, Wayne! But seriously, today we need to talk about a trend that is hitting patients hard. I just read an article by CBS News, and hear what I learned. Imagine flying from Denver to Phoenix for a vital medical consultation, only to have your appointment canceled on the spot because you don't have $5,000 in cash. That's exactly what happened to Thomas Zordani. Seeking relief from debilitating headaches, Thomas flew from Denver to the Mayo Clinic in Phoenix. But upon arrival, he was told his insurance wasn't accepted. The clinic designated him as self-pay and demanded a $5,000 pre-service deposit. Angry on principle, he refused. His appointment was canceled. Why the sudden push for cash up front? It's a double whammy for patients. Hospital prices and labor costs are soaring. And to keep premiums from exploding, insurance companies are shifting more of the burden onto patients through higher deductibles. Today, the average deductible for an employer-sponsored family plan is approaching $4,000. Hospitals know that as deductibles rise, patients struggle to pay. Fearing they won't be able to collect on that debt later, hospitals want their cut immediately. As one financial expert put it, people are basically being asked to self-insure. This isn't just happening at small clinics. Major institutions like the Mayo Clinic, Johns Hopkins, and MD Anderson all have policies requiring upfront collections for certain non-emergency, out-of-network, or self-pay care. According to Kodiak Solutions, a revenue management company, hospitals now collect about a quarter of what they expect the patient to owe, right up front. If your scan leaves you with a $1,000 copay, expect the hospital to ask for at least $250 before you put on the gown. So, what can you do to protect yourself? First, the golden rule. By law, Medicare-financed hospitals cannot demand upfront payment before stabilizing you in an emergency room. Second, always read the fine print with your insurer. If you are in-network, you have more protections. If you are asked to prepay, consumer advocates recommend asking for an itemized bill and calling your insurance company immediately. And be careful of overpaying. Getting a refund can take months, a practice that recently prompted a massive consumer protection lawsuit in Arizona. The only real defense against unexpected medical bills is absolute clarity on what your policy actually covers before you need to use it. That is exactly why Wayne built DocuClarify. DocuClarify is an automated insurance policy auditing tool. Instead of guessing your coverage, you simply run your policy through his software. It cuts through the jargon and instantly flags hidden coverage gaps, confusing co-insurance clauses, and your true out-of-pocket limits. As for Thomas, he found a new specialist in Denver, sued the Mayo Clinic under consumer fraud laws for not warning him in time, and won a $47,500 settlement. The landscape of healthcare is shifting. Stay informed, ask questions, and never be afraid to advocate for your wallet and your health. Wayne has taped a demo video about DocuClarify, and even though he needs some money for the dental work, he is offering free use of this software for a limited time. Wayne would also like it if you picked up his absolutely free RX scanner that provides in plain English the contents of medicines. Both of these applications are ad-free, so you can concentrate on the results and make intelligent decisions as you navigate the muddy waters of insurance and medications. The links to these free apps are in the description and the QR codes at the end of this podcast. I thank you, and Wayne thanks you for spending your valuable time with us.